Hi, I'm Corey, one of the licensed respiratory therapists at Choice Medical Supply. We appreciate being selected to participate in your care and are greatly looking forward to the opportunity to help you make the most of your newly prescribed sleep therapy equipment.
Let's first talk about your sleep test results. You may be wondering why you now need a Cpap and why you are first hearing about that need from Choice Medical Supply. Based on your sleep test results, it was confirmed that you have sleep apnea and your healthcare practitioner wanted you to start therapy as soon as possible. They sent us a prescription and we have already completed any necessary authorization process with your insurance. They typically want you to follow up with them in 6 to 8 weeks after starting therapy to see how you are progressing. Sleep disorder breathing or sleep apnea can cause a variety of symptoms. You are likely experiencing one or more of these prior to being tested. Excessive daytime sleepiness, loud disruptive snoring, irregular breathing including gasping and or long pauses between breaths, poor concentration and forgetfulness, depression or irritability, morning headaches, waking frequently to urinate, and dry mouth or sore throat upon awakening. It is estimated that over 40 million adults in the U.S. have sleep apnea. Not treating your sleep apnea can increase your risk of comorbid conditions. Comorbidity is the condition of having 2 or more diseases in the body at the same time or back to back. The diseases can often last a long time and be difficult to treat. The added health risks include decline in health, more frequent doctor visits, and increased healthcare costs. Here are some of the more common conditions suffered by those with untreated sleep apnea. High blood pressure. Sleep apnea is increasingly being recognized as playing a part in the development of high blood pressure while sleeping and awake, or making it more difficult to treat. High blood pressure is linked to significantly increased risks of stroke and heart attack. Being overweight or obese. Carrying an abnormal or excessive amount of body fat increases the likelihood of having sleep apnea and its effect. Studies show that sleep apnea may itself cause weight gain. Type 2 diabetes. Sleep apnea has been shown to have an effect on glucose metabolism in people without diabetes. Sleep apnea is a highly prevalent comorbidity in people who have type 2 diabetes. The likelihood that sleep apnea is found in people who have the following diseases is 83% drug-resistant hypertension, 77% obesity, 76% congestive heart failure, 49% atrial fibrillation or AFib, and 72% type 2 diabetes. Sleep apnea is typically caused by an uncommon narrowing of the upper airway during sleep, which can be caused by a variety of factors such as enlarged tonsils, relaxed muscles of the neck causing the throat to close, or the tongue falling back and including the airway. Some people snore while others do not. Cpap is the most effective and widely accepted treatment for sleep apnea. Cpap therapy involves using a small, very quiet bedside machine that non-invasively delivers pressurized air through a mask, keeping your upper airway splinted open. Treatment with Cpap has been shown to allow users to get a better night's sleep, reduce the symptoms associated with sleep apnea, and allow users to take back control of their lives. Depending on your prescription, you may be receiving a Cpap or a bilevel, commonly called a BiPAP. Regardless of that prescription and which device is used, your new equipment will come to you preset according to your healthcare practitioner's prescription and will require no initial adjustment to those settings on your part. We will cover some of the comfort features for your device that you may choose to adjust later in this demonstration. In this video, I will show you how to set up your device, how to operate it and maintain it to make the most of your sleep therapy. Because they operate exactly the same, we will use the AirSense 10 Cpap for this demonstration. As you can see behind the Cpap, there are different masks you can choose for your therapy. Although they may not all look like masks, they are all referred to as such. You will notice from behind there are different colors to the straps of the headgears. This is merely to choose size for you for your therapy. The blue typically is a larger strap for males. The violet or purple color is a shorter strap, typically for females. There is no other difference to the mask, frame, or cushion. There are 3 basic styles of Cpap masks. The first is nasal pillows. It is the smallest and lightest of all the mask styles, which is why it is most often selected by new Cpap users for their first trial. It is 2 what we call nasal pillows that fit in the tip of your nose to seal the incoming air pressure. The first thing to notice about your ResMed P10 is it has 2 distinct sides to it. The first side has no clearly visible letters on it, while the other side has 3 distinct black letters on it, indicating the size and left and right for the nasal pillows. You should be able to read these letters facing you, and they go to the bottom when you put your mask on properly. With your nasal pillow mask, you will find 3 different size pillows. Choose the one that is most comfortable and seals the air pressure the best. When it is time to order new supplies, make sure you let Choice Medical staff know which size you prefer. Included with your ResMed P10 mask, you will find 2 small buckles. They may be used on one or both of the straps at the back to help adjust the tightness of your mask for comfort. Now let's watch as I put on a ResMed P10 nasal pillow mask. First thing to notice is the straps are split. The bottom strap will go to the base of my head while the other will go across the top. Please note the gap between the 2 straps determines how tight it is. The farther they are apart, the looser it is on my face, while the closer they get together, the tighter it gets. See the gap on the 2 straps on my head. One benefit of a P10 mask is I can actually wear my glasses if I choose to do so. This is very unlikely to be able to do with any other style of mask. To remove this mask, simply pull out the front, the straps will stretch and take it off your head. The second style is the traditional nasal mask, which goes around your nose instead of in it like nasal pillows. It has a slightly larger frame to support the nasal cushion and more straps, but it stays in place much better than the nasal pillow style if you are a restless sleeper. It is a good choice if a nasal pillow mask irritates the inside of your nose, or you don't like the idea of something being in your nose while you sleep. Now watch as I put on a ResMed N20 nasal mask. Put the cushion to your nose and then pull the strap over your head. You'll notice the magnets on the side clip into place with minimal effort. Adjust the straps as needed on top and bottom. Notice the straps on the side and top of my head where they are above and below my ear. Wearing glasses with this specific mask is possible, but not as effective as with a ResMed P10 nasal pillow mask. Getting in and out of your mask is as simple as removing the magnet and placing it back together. To take it off, remove both magnets and slip off the top of your head. The third is the full face mask, which covers both your mouth and nose and is necessary for people who sleep with their mouth open or cannot tolerate a nasal pillow or nasal mask. The most common ways to know if this happens to you is that someone has actually witnessed you sleeping with your mouth open, or you wake up with an unusually dry mouth and or throat more often than not. Many medications can cause dry mouth, but since your testing proved you have sleep apnea, it is likely your mouth comes open while you sleep and your mouth cannot humidify air you breathe in. Only your nose can do that. This causes you to wake up with a dry and or scratchy mouth and throat. Now watch as I put on a ResMed F20 full face mask. I put the cushion to my face and pull the straps over the top of my head until it stops. Connect both magnets and then reposition if necessary. You can then change how tight or loose your mask is by adjusting the Velcro on the sides. Make sure to pull both at the same time and adjust top and bottom. It will likely be necessary to adjust any style mask you get to help control the leak of the air pressure from your Cpap. Now notice the position of the mask on my face, on the bridge of my nose, and halfway between my lip and chin. Please note, for those with significant facial hair, it may be difficult to seal your mask while you sleep. To remove the mask, simply disconnect both magnets and slip the mask off the top of your head. Another option is to use a chin strap in conjunction with a nasal pillow or nasal mask. This will help you keep your mouth closed while you sleep, helping to keep the flow of air through your nose. You'll notice that the chin strap is placed on first and the mask of your choice is placed over the top of the chin strap. Prior to us sending you your new sleep therapy equipment, a clinician will have spoken with you over the phone to help select the best mask for you. Let's get our equipment out of the bag and get started. So to unpack, first of all, take your box, open on the sides, and remove the bag and device. Two zippers in the front on the bag, open both of those, and open the bag. The first thing you'll find is a set of instructions in here as a reminder of things we'll talk about. Daily routine,
weekly and monthly cleaning schedule, replacement supplies, and compliance, which we'll talk about later on. This is just your printed reminder of things we'll talk about. Next is the instructions that came within the mask we help you select. First pocket has the mask we help you select here, the ResMed P10 on this case, and the power cord and supply. Next we have the humidifier chamber there, and the Cpap itself. And the last zipper pocket is the tubing we'll use. Okay. And we'll get this out of the way for now. So, our Cpap, the water chamber, tubing, power cord and supply, and the mask we've chosen. In the front pocket of your Cpap, you will find complete manufacturer instructions for the use of your Cpap. First, you will find an introduction to ResMed MyAir, an online tracking program designed to help you make the most of your sleep therapy. We will discuss this at length later in the presentation. You will then find a short quick start guide with pictures and instructions on how to adjust your comfort settings, such as your humidifier and your ramp. Okay, now to put this all together. So first of all, we'll take the power cord and supply and get it out of the plastic bag. Twist tie off the power cord to give us a little more length to find our plug. There's also some more length, another twist tie there if you need a longer room to find a plug in your room. Water chamber. Tubing with its own set of instructions. Alright, so let's take the power cord and first of all put this end into the brick and then find our plug. The other end will only fit in one place. You see yellow here and yellow inside the outlet there. Push firmly till you see some lights. There we go. Now insert the water chamber in the side. Make sure it goes in completely. All right, so now we have our tubing. We have two different ends on this. First of all, it's just a rubber cup. This is actually where your mask will go in that end. The other end has a right angle turn in it and a chip on the top. This will actually go to the back of your Cpap machine. And the way that goes in is that chip will line up with that slot right there. Only fits in one way. Firm push and clicks into place. This can turn side to side, so let's say the machine is here and you sleep over there, you can actually turn this to help accommodate that tubing. Turn side to side if you needed to. To release that tubing, just squeeze those two tabs on the side and pull. The other end we talked about, this is where your mask goes. Every mask is universal to tubing. So that connection point just squeezes into that rubber housing, okay? To remove it, just pull and push back in and take out. The last thing to do to get your Cpap ready to use is to fill the water chamber. To do that, squeeze the top and bottom firmly, hold the Cpap, and slide the chamber out. Turn that around, open the latch just by pulling that up. Fill all the way to the max line with distilled water. I have a close-up to show you there what that looks like. Be very careful not to overfill the water chamber. Now close the chamber and carefully slide that back in. Push firmly, it goes all the way, and your Cpap is now ready to use. It is important to note here that you need to use distilled water only in your Cpap. If that is not available for some reason, you may use RO or filtered water from your home. Bottled water is to be used just in case you cannot find any of those as an absolute last resort tap water, but it has the most mineral and sediment and will cause your humidifier chamber to need to be cleaned and replaced more often. Now it's time to use your Cpap machine. First, put your mask on.
and adjust as necessary. To activate your Cpap, it's simply a touch of the one button on top of your device. It will be lit up green at this point. Only after your mask is in place and adjusted should you push the green Start-Stop button to begin your therapy. Once the light changes to white, you will feel airflow coming through your mask. Adjust your mask if necessary to control leaks. The display will now show you the settings your Cpap has been programmed for. Pressure will indicate the setting prescribed by your physician. The number in the middle in the circle indicates the startup pressure, which is where it will start every time you power on your device. At the bottom, it shows the current settings for the comfort features that have been preset for you for the humidifier and ramp. You may find it necessary to change these at a later time. After 10 seconds, the lights on your display will go off. That way there is no light to disturb you while you are trying to sleep. It is important to try to keep your mouth closed and breathe as normally as possible during this initial phase of Cpap therapy, especially if you're using a nasal or nasal pillow style mask. It is likely it will feel awkward to breathe against the Cpap pressure at this point for you. Just be calm and your body will soon adjust. The first few days of Cpap therapy are typically the most difficult for new patients. Do your best to wear it as long as you can tolerate it each night. Hopefully before long, you'll be wearing it for several hours and experiencing a refreshing night's sleep. When your therapy is complete, turn the device off using the same Start-Stop button we used earlier. Take your mask off and then prepare to do your daily cleaning procedures. To clean your Cpap, first empty the water chamber. Then in a sink or tub, clean your mask cushion, the part that touches your face, to remove any oils. Gently rub with mild soap and warm drinking quality water. Then rinse the inside and outside of the air tubing with mild soap and warm drinking quality water. Note, it is okay to get the chip on the tubing wet during cleaning. Rinse the water chamber with mild soap and warm drinking quality water. Avoid using stronger cleaning products, including dish detergents, as they may damage your supplies or leave harmful residue. Note, if you are using an AirTouch foam mask, you may not submerge the foam part of the cushion in water. Now rinse again thoroughly with warm, drinking quality water to remove all soap. Place your supplies on a flat surface on top of a towel to dry. Avoid placing them in direct sunlight. Note, you may prefer to hang your tubing over a shower curtain or a doorknob with a towel on the floor to speed the drying of the inside surface. This should take you approximately 5 minutes. You will likely want to perform these cleaning duties shortly after waking to allow enough time to dry before it is time to sleep again. To complete your recommended weekly cleaning, first start by soaking your mask, the cushion frame and headgear, tubing, and water chamber in warm soapy water for 30 to 60 minutes. Then rinse thoroughly with warm drinking quality water to remove all soap. Finish by placing your supplies on a flat surface on top of a towel to dry. Avoid placing them in direct sunlight. Note, you may choose to soak your water chamber only in a solution of 1 part white vinegar and 1 part water for 15 to 20 minutes, especially if you do not have access to distilled water for daily use. Important, the water chamber should always be clean, clear, and free of discoloration. We strongly discourage you from using the product solutions listed below to clean your Cpap equipment, as the residual vapors can be harmful if inhaled. Aromatic-based solutions or scented oils, such as eucalyptus or essential oils. Antibacterial soaps. Dish detergent, even if they are mild. Alcohol. Bleach. Strong-smelling products, such as soaps with citrus. And never use a dishwasher, washing machine, or dryer. To complete your recommended monthly cleaning, simply check your filter and replace it if there is any discoloration or visible dust on the filter. Note, you may find it necessary to do this every 2 weeks if you live in a particularly dusty area. Then wipe your Cpap with a damp cloth. To access the filter, you'll need to look at the back of the machine. If you'll notice here, the humidifier chamber is on one side, the filter cover door is on the opposite side. Simply put your finger in the slot and open the door. If there's any discoloration or noticeable dust, simply replace the filter. Put the new filter in facing either direction and close the door. Even if you are diligent about cleaning your supplies, it is very important to replace them regularly to ensure optimal therapy, proper operation of your device, and sanitary conditions. Your eligibility schedule for most insurance is as follows: monthly, 2 disposable filters, 2 nasal pillows or cushions, or 1 full face cushion, the part that touches your face. Every 3 months, a whole new mask, the cushion and the frame that holds the headgear and cushion together. Every 6 months, headgear, the strap that attaches the mask to your face. Please be aware all of the supplies for your Cpap require a prescription from your healthcare practitioner to dispense. It is valid for 12 months, then must be renewed prior to being able to receive new supplies. This requires you to see them and include notes in their charting during that visit that you continue to use and benefit from Cpap use. They then forward a new prescription for Cpap supplies to Choice Medical Supply along with those visit notes. Many insurances require prior authorization, which our staff will take care of for you. Compliance is extremely important since most insurances require you to wear your Cpap a minimum of 4 hours per day at least 70% of the days during a consecutive 30-day period, which is at least 21 out of 30 days. Some only require this during the initial months of usage, while others require compliance to be proven each time you request new supplies. If you do not meet your insurance plan's compliance schedule, they will stop payment, forcing you to have to pay for the remainder of your equipment and any future supplies, or simply return your Cpap. Your Cpap is monitored remotely by Choice Medical staff according to insurance regulations. Medicare requires you to achieve this 70% compliance mark within the first 90 days of therapy. Upon meeting your compliance, you are required to again visit your healthcare practitioner to confirm this in your medical record. This visit cannot take place prior to 30 days from your start date of therapy to complete this requirement. Please notify Choice Medical Supply staff at least 24 hours prior to this scheduled appointment so we can forward your Cpap compliance record to their office, ensuring it will be in your chart prior to your arrival. Without this, Medicare will not pay the remaining months of rentals for your equipment, and you will be billed. Note, Medicare payment for Cpap is a 13-month rent up to purchase. Your Cpap is designed to be travel-friendly and packs up easily in your bag. Once you become accustomed to getting a better night's sleep, you won't want to leave home without it. First, it is extremely important you drain your water chamber prior to moving your device. If it is ever moved with the water chamber still in and containing water, you will likely damage or ruin your Cpap. Carefully pack each separate component according to the pictures in the travel bag. Each item has its own place for safe travel. Notice the pictures in your bag indicating the proper place for each part of your Cpap. If you travel by plane, it is important to carry on your Cpap. If you pack it in your suitcase or bag, it will likely be damaged from the rough handling of luggage. It can be scanned or x-rayed with no harm to the device and should not count against you as an extra bag as it is a medical device. Simply inform the airport personnel it is a Cpap. If there is any question, there is a label on the bottom of the device stating RX only, meaning you could not have received the device without a prescription from a healthcare practitioner. If you travel internationally, the power brick is an AC converter, making your Cpap usable anywhere in the world. It can handle power from 100 to 240 volts. As mentioned earlier, ResMed has an online support program that can automatically send you therapy data via any mobile or web-based device. You will get a daily snapshot of how well you slept, earn badges when reaching milestones in your treatment, learn ways to improve your comfort and sleep better, and know if something is wrong with your machine or your therapy. We greatly encourage you to take advantage of this simple to set up but powerful tool. Register today at resmed.com/myair or download the free MyAir app. It's like having your own personal sleep coach. This may all sound a little complicated, but your new Cpap is easy to use, maintain, and travel with. You will now have support from your personal sleep tracker, ResMed MyAir, the respiratory therapist at Choice Medical Supply, and your prescribing healthcare practitioner. With this much help, you're on your way to a healthier and better night's sleep. If you have any questions or concerns about this presentation or your ongoing therapy, our staff is available to assist you from 8 a.m. to 5 p.m. Monday through Friday. Good luck to you on your new journey. Now go get some sleep.